Hi everyone. So I am Dr. Shinto Francis. I am the chief and senior consultant in the Department of Clinical Hematology, Hemato-Oncology, and Bone Marrow Transplantation at the Baby Memorial Hospital at Calicut, Kerala. So today I'll be talking about treatment options of blood cancer. As we all know, blood cancer is deemed to be a deadly disease. Okay. Treatment options in blood cancer. So, blood cancer in this era is not as deadly as it seems. Okay. So, there is always a ray of hope. There are multiple options that you have so that to cure a blood cancer, that is not a dead end. What all do you have? So, what do we know about blood cancers? So, blood cancer is also known as hematological cancer or hematological malignancy. So, it is a disease of the blood cells. Okay, so blood cells meaning we have red blood cells, white blood cells, and platelets, right? These three are the major blood counts. Any disease which is affecting these kind of cells are grouped into the category of blood cancers. Basically, these are grouped into mainly three major categories. So we have heard of leukemias, other things are lymphomas and myeloma. So leukemia, lymphoma, and myeloma are the major category of blood cancers. Okay, the treatment options for all these three depends on various factors. We all know it depends primarily on the patient. The patient's age will decide the treatment. Okay, the patient's performance status. So performance status the indirectly reflects to how well he will tolerate different types of therapies. So age, performance status, patient's wishes, right, and the stage of the cancer, and how extensively the cancer has been spread. So other factors include other patient personal preferences and financial background as well. Okay, so the all this has to be taken into account when you decide a treatment for a particular kind of a blood malignancy. So we'll discuss about the various available treatments in this date. Broadly, these treatment options are categorized into four. Okay, so we all might have heard of chemotherapy, right? Anywhere there is a cancer, the therapy is chemotherapy. From chemotherapy, there is an adjuvant, there is something called a radiation therapy also, which can be utilized for a specific type of blood cancers. So chemotherapy, radiation therapy, and now move on to latest era methods to treatment like immunotherapy and stem cell transplantation. These are the four major. When we group these treatment options, we can group into these four options, right? So coming to the chemotherapy, this is age-old chemotherapy. So chemotherapy is basically, these include drugs, okay, medicines which can kill the cancer cells. So these medicines, these are commonly used in the treatment of blood cancer from many decades. Okay, so basically these are administered in many ways. We all know that can be administered in an intravenous manner. It can be taken orally. There are oral chemotherapy tablets, okay, or even certain medications can be given subcutaneously, just like an insulin injections. So what happens is that when you give a chemotherapy, these drugs go and circulate in the blood, and they directly kill the cancer or the malignant cells. Right. So some of the common drugs which we use are like the treatment of blood cancers include anti-folate drugs that will cut off the folic acid, that is the nutrients. Okay, so that includes methotrexate. Certain drugs which damage the DNA like alkylating agents, cyclophosphamide, okay, melphalan or vincristine. Vincristine is taken from it's a vinca alkaloid taken from plants, okay, which is processed into a chemotherapy. So chemotherapy is basically, how do we give a chemotherapy? Is basically given in cycles. Okay, cycle meaning every 21 days, every 28 days. So why this cycling? Because there should be a period of time which has to be given for the recovery of the cells. Because this chemotherapy drugs, when given say IV intravenously, it kills both good cells and the bad cells. Good cells are our own cells, own normal hematopoietic cells, which produce normal blood, and the bad cells are the cancer cells. So when we give a chemotherapy, all the cells will be destroyed. Okay, so from that, there should be a period of time where the normal cells can recoup. So that period of time varies from 7 days to 28 days, somewhere around. Okay, depending upon the type of chemotherapy which we are giving. Okay, so depending on, and also the number of cycles of chemotherapy is also dependent on the stage of the disease Okay, what kind of a cancer you have, so etc. What are the everybody is worried about the side effects of chemotherapy. So side effects of chemotherapy, because this being a chemo drug which can affect the normal cells also, this normally usually includes nausea, vomiting, certain loose stools, GI, bowel upset. Okay, then you can drop your counts meaning you can have anemia, HB can be low, where you can feel fatigued. Okay, and total count can be low, where you can get many sorts of infections, which is a dangerous situation, and platelets can also drop, which can cause bleeding manifestations. In general, chemotherapy covers this, have more of a common side effects like this. So moving on to the next is radiation therapy. Basically, radiation, what is radiation? Radiation, we all know, these are high energy radiation, possibly X-rays or gamma rays, which can kill the cancer cells. Okay, so it can be done as a local treatment, which basically means to target a tumor mass at a particular region, which can be covered in a radiation field. So types of radiation, because in blood cancers, this radiation therapy is basically utilized in lymphomas and myelomas, where you have a tumor cell, there is plasmacytomas and all, because by meaning that there is a tumor mass somewhere, okay, where you direct the radiation beam and destroy the cancer cells. So it can be, radiation can be divided into two types. Basically, externally, it can be applied externally, or it can be given internally. So externally, it is called external beam radiation, external radiation therapy, and where there is a machine outside the body and you get a radiation beam, okay, directed towards your cancer or tumor. And this internal radiation therapy, and what we do is place a radioactive source inside the body close to the tumor, so that the tumor cells will be destroyed. So what could be the side effects of radiation therapy? Radiation therapy, again, it can cause skin changes, some amount of fatigue, then it can cause drop in counts. It can also, which can lead to multiple infections, also some amount of nausea, vomiting. So it depends on where you are radiating, how much radiation you are giving, etc. So in hematological malignancies, basically lymphoma, like Hodgkin lymphoma, non-Hodgkin lymphoma, where you have a bulky disease or a large tumor, after giving, it can be given along with chemotherapy or as a primary therapy as well, to shrink the mass or to destroy the whatever residual mass you have. And in myelomas, like plasmacytomas, say if you have a tumor pressing onto some vital organs or spine, you can radiate that particular mass so that it will shrink. So that completes radiation. Okay, so now moving on to third is stem cell transplantation. So stem cell transplantation is basically known as, previously it was known as bone marrow transplantation. So in stem cell transplantation, that is a procedure which is used to destroy the damaged cell by meaning leukemic cells or lymphomatous cells, whatever the cancerous cell is, to destroy everything. So we have to give some chemo, destroy the tumor to maximum possible. Then you consolidate it by giving a destroy till the roots of the cancer cells should be destroyed. So we give a stem cell transplantation. Okay, so basically destroy the cancer cells and replace it with a normal stem cell. Stem cell is meaning hematopoietic stem cell, which give rise to the normal blood cells. So abnormal is gone and you replace it by a normal stem cell. So what are stem cells? Stem cells are basically the immature cells which can give rise to all the blood cells. They reside in the bone marrow. Okay, so we utilize that cells to recoup from a high intensive chemotherapy. So stem cells are those cells which can give rise to other blood cells, all other blood cells. So stem cell are transplanted into a deceased person after destroying the cancer cells, so that there is a reboot of the system. So there are two types of transplantation. Okay, one is autologous stem cell transplantation. In autologous stem cell transplantation, what we do do is the patient's own stem cells are taken out, because these are done in diseases where there are lymphoma, myeloma. We make use of autologous stem cell transplantation. What we do is, if you have a myeloma or a lymphoma, you treat with a chemotherapy, reduce the disease to minimum, then you take out the good cells, that is the stem cells. You keep it outside after apheresis, which can be done by a simple procedure like called apheresis, which is the taking out of the stem cell. It is just like a blood donation, which is taken with the machine. The patient or the donor just have to lie down. So it's a 2 to 3 hour procedure. Okay, so painless procedure, probably pain for line insertion and all. Other than that, it is a safe procedure. So you donate the stem cells. The patient donates his own stem cells, and he is given high intensity chemotherapy so as to destroy whatever residual cancer cells are there. And then you put back the stem cells, his patient's own stem cells, so that the recovery will be faster. Okay. So autologous stem cell transplantation, it is otherwise called high dose therapy followed by stem cell rescue. So basically the stem cells, the patient's own stem cells are utilized to hasten the recovery of the counts. So the second type of transplant is allogenic stem cell transplantation. So allogenic stem cell transplantations are done in conditions like leukemias, or like certain benign other conditions like thalassemias, etc. So what is the difference from autologous? So here allo meaning a different person. So HLA match. So genetic match is called HLA match. You find a donor who has a similar exact match, or exact or even half match. There are different types of matching. You have an exact tissue matching, which is called HLA matching. You find a donor and stem cells are taken from that donor. So this is called allogenic transplant. It is not the patient's own stem cell. So this is done in conditions, as I said, in leukemia, where the stem cells are turned into a malignancy or cancer. So there is no point in putting back the same cells. Okay, so you need a donor. That's why we do an HLA match. So if you find a fit matched donor, you take the stem cell from him just like a normal peripheral blood apheresis, and after giving a chemotherapy to destroy the immune system of the patient and the immune system as well as the cancer cell of the patient, you put the stem cells from the donor. This is called a allogenic stem cell transplantation. So transplant, all said and done, both these transplants, these are complex procedures that has significant risk, including severe infections, graft versus host disease. So the graft, meaning the stem cell which are put from a donor in allogenic transplant, can react against the host. It is called graft versus host disease. And there are multiple organ damage risk as well. So patient undergoing the stem cell transplantation requires close monitoring and care. So moving on from chemotherapy, radiation therapy, stem cell therapy, in 2023 we will be talking about immunotherapy, right? So this immunotherapy is basically a type of cancer treatment that basically utilizes the patient's the body's immune system to fight against the cancer cells. So it works by either it stimulates the immune system to attack the cancer cells, or it blocks the signals that cancer cells use to evade the immune system. Basically, our immune system has a check mechanism on cancer development. So once this cancer cells, what they do is they evade this kind of a immune check mechanism. So we stimulate this signal or block those signals so that these cancer cells are under the radar and they get destroyed by the this immune system itself. Okay, so it is used to treat certain type of this blood cancers, especially lymphomas and multiple myeloma. Okay, myelomas. So several types of immunotherapies are there. Include one is monoclonal antibodies. The next one is the checkpoint inhibitors, and nowadays there are CAR cell therapies. So what are monoclonal antibodies? These are basically laboratory produced molecules. Basically, this targets a protein, a specific protein or a target on the cancer cells, and goes and bind to that like a lock and key mechanism and destroys specifically that cancer cells. Okay, so like rituximab, the one drug is there. It is a CD20 blocker. So CD20 expressing cancer. So that is a marker on cancer cells, like the example lymphoma. So CD20 positive lymphomas can be targeted by anti-CD20, which is called rituximab. So it goes and binds to the 20 marker, so it destroys it. This is monoclonal antibody, classical example. So second comes the checkpoint inhibitors. So they basically blocks the proteins that prevent the immune system from attacking the cancer cells. Okay. And third comes the CAR cell therapy. So CAR cell therapy meaning chimeric antigen receptor T cells. So they basically include taking out the patient's own T cells. So T cells are the immune cells which attack cancers or infections, right? So what we do is we take out the T cells, engineer it in a lab so that it can be targeted against a tumor cells. So basically what you do is re-engineer the T cell repertoire and then multiply it and put it back into the patient so that it can go. Now it is like a mercenary targeting the particular cancer cells, whatever we want to target. So it is designed to strengthen the immune system to fight the cancer more effectively. So even though it is effective, there are target has to be designed, and there is a complex process involving choosing the target, how we design the target, and how the CAR cells are processed. It requires its own setup. Right. So, and side effects. Are there any side effects for these immunotherapies? Definitely yes. But it's a specific kind of side effects which is particular to that particular kind of a therapy, whether monoclonal antibody, CAR cell, or immune checkpoint inhibitors. They have their own particular side effects. What all side effects can happen? Like rashes, it can cause fatigue, or this kind of a mild side effects can happen, or even others which require prompt medical care like cytokine release syndrome, neurological problems, etc. So thank you so much for listening.